go ahead and get started.
Yeah, I think we're going to need all of our time today. So yeah, let's get started. Hey folks, welcome to our third installment of the University of Montana Alumni Virtual Engagement Series. This series is designed to keep you engaged and informed about the great things going on at the University of Montana, and it is brought to you by the Alumni Association. This is our first jump into the Zoom platform, so just a couple of requests before we get started today. First, please remain muted at all times during this presentation. Second, our presenters will answer the questions many of you submitted in advance. And if you have additional questions during the session, please use the chat feature on Zoom to ask your question anytime. You'll find the chat in the center of the toolbar at the bottom of your Zoom window. We will move to the questions after each of our expert guests offer some opening remarks. Today, we have three of my esteemed colleagues from the University of Montana's Department of Psychology to give you their perspectives on what the field of psychology has to offer as we navigate this pandemic. I'm joined today by Professors Bryan Cochran, Chris Fiore, and Rachel Severson. Let's start with Bryan. Dr. Bryan Cochran is professor in the Department of Psychology at the University of Montana with affiliate faculty positions in Women's, Gender, and Sexuality Studies and in the School of Public and Community Health Sciences. His research areas include the psychological impacts of having a stigmatized identity, such as being LGBTIQ plus identified, and the understanding and treatment of substance use disorders. As a member of the core clinical faculty, Dr. Cochran is a Montana licensed psychologist who teaches undergraduate and graduate courses and who mentors students in the clinical psychology PhD program. He's also a co-investigator on an HRSA-funded training grant that places student trainees throughout Western Montana in primary care settings. Dr. Cochran received his PhD in clinical psychology from the University of Washington in 2003, having completed his internship at the Seattle VA Medical Center, and he has been on the faculty here at the University of Montana since that time. Welcome, Bryan.
Thank you so much, Justin. It's really nice to be able to join this Facebook Live audience and to be able to talk a little bit about what psychology can contribute to understanding the pandemic. I realized as we were putting this together, there's so many different ways that psychology has a lot to say about how to understand our current situation. So each of us is going to focus and turn on just a few different points in terms of trying to explain our perspectives on how psychology can contribute to better well-being and better health during this particular time that we're going through. My particular focus is going to be talking a little bit about psychology research and practice for the pandemic. I've divided my points into a couple of different areas. You'll have these slides available in the whole recorded presentation later if you want to go back and look at any of these points for any of us or the resources that we're going to have listed at the end. One of the things that I wanted to focus on first is talking a little bit about coping with anxiety and figuring out how psychology research and practice can help us to cope with the anxiety that many people are experiencing during this time. I should note that anxiety and depression go hand in hand. Many people think of them as unrelated clinical constructs, but really when people experience anxiety, they often experience significant amounts of depression and vice versa. So instead of thinking of them as separate, it's really like two unwanted house guests that arrive at the same time. So any of the things that we're talking about in terms of treating anxiety are also beneficial for treating depression as well. People have their own anxiety management strategies, and there are a number of different ways that people might be using those during this time or want to engage in anxiety management in new ways that might be beneficial. So one of the things that's important to note is that these strategies are idiosyncratic, and some things might work for some people, but not for others. So it's worthwhile to try a variety of different strategies to see what might be most beneficial for you. When we think about kind of what these management strategies have to do with our body and how it creates a feedback loop between our mind and our body, which of course are not separate constructs, but are interrelated as well, basically you need to think about how we've got a couple of different systems that tell us that we're experiencing anxiety or fear. One of those is the famous fight or flight system, the sympathetic nervous system that kind of speeds up our heart rate and breathing and tells us to prepare for something that's anxiety provoking as an immediate threat. We also have a different system that has to do with cortisol and a number of other hormones that are secreted that kind of are in response to long-term activation of anxiety. So whether we're talking about one type of anxiety system or the other, all of these strategies can be beneficial in reducing the level of anxiety that we feel. One way of thinking about them is when our body is telling us to be anxious, it's important to think about ways to have your mind to tell your body to reduce that level of anxiety. And I'm going to go through a few different possibilities for that as well. One of these, and one of my favorites, is called square breathing. Square breathing, and also a related construct, diaphragmatic breathing, has to do with thinking of your breathing as not just in and out, which most people think of, but thinking of it as a square where you breathe in, pause for a few seconds, and then exhale and pause for a few seconds afterwards. You can look up a lot of great YouTube videos on how to do this that'll help you pace yourself. But basically the idea is to slow down our breathing so that we're telling our body to calm down in various ways. And whether that be accomplished through yoga, meditation, diaphragmatic breathing, or square breathing, all of these are really effective ways to reduce your anxiety in the moment. One way to think about managing your anxiety is to focus on what you can do to manage in the moment. So what are the things that you can do to reduce anxiety when you're feeling overwhelmed in the moment? One of these is giving yourself cognitive strategies or telling yourself ways of thinking about your anxiety that might be beneficial. For example, reminding yourself that you're only able to do so much at one point in time can be really helpful. Many of us feel like we're carrying the whole weight of the world on our shoulders during this time, and reminding yourself that you only need to carry your own share can be beneficial so that you don't feel like you're taking on more than is necessary. A number of different ways might be helpful for different people, again, in trying to figure out how to manage your anxiety. One of the researchers in worry and anxiety, Tom Borkovic, has a great strategy where he talks about worrying being something that easily gets out of control. And I think many of us feel this, where we start to get anxious, and then it kind of is like untangling this ball of yarn that has a lot of anxiety attached to it. Our worries can sometimes feel like they don't have a container. So Tom Borkovic talks about giving your worries a container, essentially either making a list of things that you're worried about, or even giving yourself a few minutes each day to worry and immerse yourself in that, as opposed to letting worry spill into every moment of your waking existence. The next thing that I want to talk a little bit about is seeking social support. And seeking social support is kind of one of the great axioms of clinical psychology, which is no matter what it is that people are dealing with, when they seek out social support, they tend to feel better. That's a really consistent finding in the literature. So social connections benefit ourselves, but they benefit other people as well. I want to remind people to reach out to others. And that kind of has a dual benefit. It both activates yourself, meaning that it makes sure that you're doing something to stay active by reaching out to other people. And in fact, behavioral activation is one of the main treatments for depression that has been shown to be effective. But it also helps you to check in on loved ones to make sure that they're okay as well. I also want to point to the research on altruism. So doing things that are beneficial for other people also has this benefit of making you feel better while also helping other people feel better at the same time. Focus on the things that you can do. Maybe you've got a housebound neighbor or someone who's unable to leave their home, but you can run an errand for them or get groceries or leave a baked good at their door, or something that's going to be helpful for them. Look into your community and find out what your community needs are, and maybe there's ways that you can help there as well. I know that times are tight, but for some people, being able to donate even a small amount of money can be helpful in terms of activating that altruistic spirit and making sure that we're helping other people. Also, explore new ways of connection. So many of us have been bemoaning Zoom and the other kind of social media platforms during this time, but I would encourage people to still give them a try and figure out ways to connect with others, even though it's not maybe our natural tendency. So earlier today, for example, my parents aren't big Zoom fans, but they're in South Carolina. they're big gardeners and I'm a gardener as well. So we FaceTimed and we went outside and we were showing each other where all of our plants were going and what we were growing this particular season. And it was kind of a nice way of feeling like we were together, even though obviously most of the country is separating us at this point. The last thing I want to talk a little bit about is learning from previous pandemics. And actually, it's not really previous pandemics, but the current HIV/AIDS pandemic. So as Justin mentioned, a lot of my work has to do with looking at the experiences of sexual and gender minorities. And many people who have lived through the early phases of the HIV/AIDS pandemic remember these times of fear, these times in which we didn't really know what was causing HIV and AIDS. We didn't even know it was a virus necessarily or how it was spread. So I think it would be really helpful for us to think about what do we learn during this pandemic of HIV/AIDS that can be translated into our current knowledge and help us in terms of coping with COVID-19. It's really interesting to think about this. One axiom, I think, is that fighting a virus is a marathon, not a sprint. So it's something that we're really kind of in the early stretches of. And the HIV/AIDS pandemic, early cases were identified in 1981, but we still have over 38 million people in the world who are living with HIV. So this is a pandemic that is consistently affecting really about 9 times more people than currently have COVID-19. So it would be a shame not to learn from this particular pandemic and figure out what we can translate to coping with COVID-19. One of the things that we've learned, rapid testing and effective treatment are everything. They're the most important tools that we have, along with research in making sure that we curb the spread of the disease and making sure that people know their status. Many people remember an era in which HIV tests would take 2 to 3 weeks to come back. Rapid testing is, of course, extremely important in public health interventions. Also, personal precautions, the things that each of us do to prevent the spread of disease to ourselves and to others, which are different with HIV/AIDS than they are from COVID-19. With COVID-19, they're wearing a mask, washing your hands, limiting your social exposure, and maintaining social distance. But these personal precautions really are public health interventions. And it's important to think of everything that we're doing individually as things that translate into the common good. Finally, there's always unexpected heroes in every crisis. And these unexpected heroes, of course, are our frontline healthcare workers that we're identifying now, but there are also artists, activists. We've got this particular painting by Keith Haring, who, of course, was someone who was living during the HIV/AIDS pandemic and brought a lot of public attention to the importance of people living with HIV. So I think it's important to remember, learn from what we've already experienced in terms of the HIV/AIDS pandemic and making sure that we're able to use that knowledge to benefit us at present. So next, I'd like to turn back to Justin so he can introduce our next speaker.
Super. Thank you, Bryan. Next, we have Dr. Christine Fiore. She is a professor in the Department of Psychology at the University of Montana. Christine is also interim director of the Student Advocacy Resource Service, or SARC as we call it here on campus. And she is an affiliate faculty member in Women's Gender and Sexuality Studies. Her research is focused on violence against women. Her training is as a clinical psychologist, and it's included child to adult services. She has a particular focus on training graduate students in practice across the lifespan in motivational interviewing. As a faculty member, Christine teaches graduate and undergraduate courses as well. She is currently faculty advisor to the Women's Leadership Initiative. Dr. Fiore graduated with her doctorate degree in clinical psychology from the University of Rhode Island in 1990, completed her internship at Brown University's Psychology Consortium, and worked at the Duke University Medical Center in medical psychology before joining the faculty here at the University of Montana in 1992. Dr. Fiore, welcome to this alumni session. I think you're on mute, Chris.
Thank you for the invitation and for the chance to be with my colleagues and the alumni to talk about how to manage all the psychological and emotional impacts of COVID. And as Bryan said, there is plenty to talk about. So it's been a trick to focus this. And for some reason, it's not there we go. Okay. So I have Now it's backing up. Okay. I have a focus on working with couples and families and children also in training. Bryan and I are clinical psychologists, which means that we are healthcare professionals, and we provide treatment for in different specialty areas. We have Dr. Severson following us, who's a developmental psychologist who has excellent research and teaching background in developmental psychology. But Bryan and I are in practice, so we have a slightly different angle. When I thought about preparing for this, I thought about a lot of the questions that have come up to me from friends, family, acquaintances. And there is a lot of stress with a lot of what COVID brings. And so I wanted to focus on addressing some of the things related to couple stress, family stress, and children's mental health specifically. So one person that I thought summarized a lot of the work well is Cynthia Baum-Becker, PhD. And she cites that there are really some basic things for us to keep in mind as couples and in our relationships. And the first is pragmatism, this idea that we actually can let go and let things go and things will be okay. A lot of what I'm hearing from people is increased stress over wanting things to be the way they were without quarantine, without shelter in place, without the risk of virus, and we just aren't there. So similar to Bryan's talking about it's not a sprint, it's a marathon, there's this idea of what we're in, we need to adjust to and accept and maybe let go of a few things that we hold on to in couples relationships. But in families, the idea of letting go would be picking your battles with children and teens. Be always stronger, kinder, and wiser, which is an attachment theory of how do we maintain relationships as a priority over everything else. And families also, this would involve committing to fewer conflicts, the idea of letting go. You could have a battle over something, you could have conflict, but you can also let it go. And then providing structure when you can so that you can let go of more. Structure actually contributes to letting go. The other thing cited is this balance paradox. And a lot of people who are now suddenly with children, teens, and partner day in and day out are experiencing lovely things about all being together and then overwhelming feelings of, I can't take this anymore. Okay, those are totally normal things. And in the balance paradox, we actually need both of those things. We need connection and we need separation. And we may need to structure, work with our partner to make sure we get those things. It's not asking a lot and it's not wrong to need both. It's actually normal to need both. And right now, when we're spending so much time together, it's all that much more important to honor it. And in families, we need to allow for balance as well. And sometimes we need to seek support to achieve this. A lot is being demanded of us. I think Rachel is going to talk about the working from home experience with children and teens, which is really more like trying to work from home. So we need to figure out how to achieve balance in a way that is good for us and our family members. Cognitive affective differentiation is this idea is that we're all going to cope with this differently. In couples, the adults will have different ways of coping, and recognizing that another person's way of coping may work for them and not work for you. Bryan gave some ideas on how to cope with what APA, the American Psych Association, is calling COVID anxiety. And children also are going to, and teens are going to cope differently. And so we have to have an ability to allow for that difference. It also, that coping is going to be different across the age span. Okay, so it's just something to be aware of. Then there's this idea of affective optimization. We all have a lot of feelings going on right now. It's a lot emotionally to really digest, understand, experience, process. And one of the things that we've learned is that naming emotions, sharing them, and accepting that some things are unknown, even in our emotional state, helps us. And we can share this with partners, and we can help children and teens to label emotions and share them as well and make it acceptable. The next, I forgot about, I think, emotional generosity. But somehow emotional generosity is being the kind piece and just allowing breadth and depth of experience with each other in a couple relationship and in the family. The next is, and I don't know, I don't have my timer going on, so someone can warn me. I have a lot of things up here, but basically with anxiety and worry and children's mental health, we have some concerns, and I think they were also expressed in some of our questions ahead of time. And COVID anxiety is really real. APA actually has, and there's been a measure developed for COVID anxiety. But I think what's really important is for adults to be able to be in charge and take care of your own anxiety and try to help your kids be separate from your anxiety. So you remaining calm helps your children to feel like children instead of responsible for the world, okay? So there's a lot of trying to remain calm and reassuring recommendations, and in attachment world, we talk about establishing a safe haven. And sometimes we have to do this by realizing that there are only so many things that we're talking about that are good for kids to be a part of, especially on their developmental age. So we want to be considerate of exposing kids to media and social media information that might be scary or overwhelming. And we want to be aware that the kinder, stronger, kinder, wiser part of us can help our kids not feel our own anxiety. So it's about reassuring and being a safe haven for your children. And then, of course, take care of yourself. We know this. We all hear it. We know that you need to do this in order to be able to help your children manage a big unknown. I've been calling this a big unknown. I talk about it as holding a part in your brain constantly, where we're trying to resolve this unknown piece of what this pandemic is. And we don't have the answers. We don't know what it's going to be like in a month. We don't know what it's going to be like in 2 months. And our brain really works hard on that. So I'm going to go to the next one. I think I'm pushing on my time. And see if I can get it to change. I'm controlling Ryan's, there we go. Okay. Finally, I do have this specialty in trauma, and I think some of you have heard about concerns about increases in child abuse and violence against women. And I think that is a significant risk when we're all stressed out. We may have disruption in our financial picture and work picture. We may have difficulties depending on what's happening in our own personal life, our extended family life. So stress is high. But one of the things we know about human beings is some of what Bryan talked about as well. And this is that we actually are designed and built to manage these challenges and to take on stress. We really are. That's why we have a cortisol, hypothalamic pituitary axis. That's why our brain, we have fight, flight, and fright. What we want to do is do our best to manage it. And so right now, I'm going to use Bryan's, we're in a marathon. We're in a marathon of big unknown proportions. We have AIDS pandemic, we have the Spanish flu, we have some hint, but we don't really know exactly what we're in for. And that creates uncertainty that can complicate things for people. If people have had previous traumas, this kind of uncertainty and lack of control can trigger more difficulty managing what COVID is presenting. So similar to recommendations for children's mental health or couples or families, if it becomes big and overwhelming, there are healthcare professionals out there, mental health care professionals that are doing their work. Bryan and I are still working with people. Our clinic on campus, they're still working with people. We're all doing our work through Zoom. Not ideal, but better than not at all. So that's, I believe, the end of mine. If I can get it to move, there we go. Thank you.
Super, thanks, Chris. And finally, we have Dr. Rachel Severson. Rachel is an associate professor in the Department of Psychology here at the University of Montana and director of the Experimental Psychology Doctoral Program. Dr. Severson is the director of the Minds Lab, where she and her research team investigate how children attribute minds and internal states to human and non-human others. Things like non-human animals and animate nature and personified technologies such as robots. She also studies the moral and social consequences of doing so. Rachel directs the UM Living Lab, located in the new Missoula Public Library, which will open this summer, to engage the public with research conducted at the University of Montana. Dr. Severson received a PhD in developmental psychology from the University of Washington. Prior to joining the faculty at the University of Montana, she was a postdoctoral research fellow at the University of British Columbia and a Fulbright fellow at the University of Oslo. Welcome, Dr. Severson.
Thank you, Justin, and thank you for the invitation to join us here. Can you hear me, everyone? Okay, good. So I'm gonna spend my time focusing on children, and as Chris mentioned, I'm a developmental psychologist, which means that I study children's typical development, and I focus a lot of my work on children and technology. So I want to cover 3 topics today, talking about screen time, talking about learning at home, and then for parents and caregivers that are shifting into this role overload. Okay. So as many people are probably aware, the screen time rules that we've tried to enforce in our homes have probably gone out the window, as you know, we have kids that are school age that are now learning remotely at home and using devices to do that. And the days at home have now shifted to weeks and months, and it's meant that children are engaging in a lot more screen time than what had happened pre-pandemic time. So first, I just want to say that parents shouldn't feel guilty about this. Parents are spread really thin right now, juggling competing demands, and we'll talk more about that here in a moment. But as you think about screen time for your kids, I like to think about Kathy Hirsch-Pasek, who a developmental psychologist colleague, that points out that screen time isn't inherently good or bad, but it's what matters are the choices we make about the types of content. And so what we want to choose are interactive, engaging, and meaningful content to the extent that we can. And it's really important, particularly with young children, as much as possible to be part of their viewing, to really help them understand and apply what they're seeing. And also to point out that video chats with family and friends allow kids to connect socially. And in those video chats, it can be really engaging for kids, allowing them to connect with the person they're chatting with to do actual activities, whether it's playing a game or reading a book, having a snack at the same time, or dancing or singing, playing toys. And just as one example, my son, who is 4.5, loves Paw Patrols, and he has his Paw Patrol, and his grandmother has her Paw Patrol, and they play Paw Patrols together over FaceTime. And this has been a really positive way of connecting socially in this time when we have to be physically distant. The next point is that boredom is beneficial. So it's really easy for kids and even adults to get in this mode of constant stimulation, always looking for that next thing to engage us. But it's really okay for kids to be bored. And in fact, I'm going to suggest that it's actually good for them. It provides them this time to explore their own thoughts, their own dreams. And importantly, at a neurological level, this time when we're not actively engaged in an activity allows the brain to shift into the default mode of functioning. That's very important and linked to skills such as self-awareness and empathy. And I would like to suggest too that we don't have to throw all the screen time rules out the window. And so although we may have increases in the amount of time that kids are spending on screens, that some rules can remain. So for example, limiting screen time in that hour prior to bedtime is really important, particularly for younger kids who are especially sensitive to blue light's effects on melatonin production. And that's due to their relatively larger pupil size and clearer lenses. And also for the older kids and teens to really limit that late night media use, which we know negatively affects children's and teens' sleep. And that can in turn negatively affect their mental and physical health. Okay, so moving on to learning at home. Parents have been put suddenly into this role of not only being a caregiver, but also being a teacher. And so I just want to talk about some of the things that may be helpful as you're in that role. So the first is that really we can have developmentally appropriate expectations. And let's see if I can get, there we go. So as we think about different ages of kids, whether you have preschoolers, kids in elementary school, middle school, or high school, your expectations for what they may be able to do remotely should be developmentally appropriate. And so older children, maybe 9 and up into the teenage years, they can really engage independently or mostly independently with some checking in on the part of their caregivers. But younger kids really need to have social engagement. So just to kind of calibrate this, when we are like looking at preschoolers and assessing their ability for sustained attention, 10 minutes of engagement on a task is considered prolonged sustained attention. And for 5 and 6-year-olds, it's 15 minutes. And so we can't expect young kids to be able to engage for hours on end without having that social engagement, in this case on the part of their caregivers. And it's really normal for kids, particularly the younger ones, to have to switch tasks often. So just to kind of set what might be appropriate expectations for what your kids can do. And what we know about online learning is that it is most effective with a supportive adult and when it's connected to the real world. And so oftentimes that adult can help kids make those real world connections. Now, this is where online learning is the most effective. And it may not be that we can provide that all the time in current times. Okay, next point is that with thinking about learning at home, that we really need to chunk their learning and include a lot of activity breaks. So children, again, learn best when there's small bits of information over a sustained bit of time. And this does not require formal instruction. In fact, puzzles and hands-on play are predictive of math achievement years later. Oral stories, drama, and even simple conversations are seeds for literacy. And so you don't need to have the expectation that you're perfectly replicating what's happening by a teacher in the classroom. In fact, that isn't a reasonable expectation. And activity breaks are really critical for learning. This is a point that I try to drive home when I'm teaching my undergrad course on child development, that physical activity is so critical for cognitive functioning. And this is true not only for children, but also for adults. So it's really important to build in activity breaks for kids and, adjust for what makes sense for your child, or if you're passing this information on for others, it may be that it's a half an hour of some focus time, and then it's a 15-minute break and to run around. There's lots of different ways that we might structure that, but those activity breaks are really important. And then final point about learning at home is having both a routine and flexibility. So Chris mentioned that structure is really important, and Bryan said that it actually is even helpful in kind of freeing up some space. And the structure is really helpful for kids. And of course, this new routine that we've created or maybe revising will not and cannot mirror the pre-pandemic routine. So what you might consider is co-creating a routine, a plan with your kids, with your family, and then test it out. So first, children will be much more invested in this plan if they're able to participate in creating it. And then revisit the plan. What's working well, what isn't working well, and then revise accordingly and try it out again. So importantly, if kids aren't able to adhere to the plan, it's better to recognize we need to shift our plan around here rather than punishing the child for not adhering to the plan. So this is a really nice way of helping kids recognize when something isn't working, and then they can be part of the solution and, how could we make this work better? And so ultimately, as parents, be flexible and understanding when you need to vary from the plan. And remember that everyone is in this same pandemic, not that we're all in the same boat. People have a lot of different experiences of this, but there's a commonality to it as well. And then finally, I want to just say a few words about role overload that parents and caregivers may be experiencing. And so I'll start this off by sharing a quote from Kara Baggett, who is in the Department of Psychiatry at Mount Sinai School of Medicine. She writes, "In one fell swoop, you've become a stay-at-home parent, a teacher, and a frontline responder, aka superhero. Be patient with this transition. It may be rocky at first, but children are adaptable and will thrive with well-intentioned efforts." And so in this role overload, just to emphasize again, co-creating a plan, and this time not focusing so much on the learning plan and activity plan for your kids, but a strategy for your family. So many parents are now working remotely. Some are still working at home, and some aren't working at all. And so there's going to be a lot of variability with what this plan might look like. But based on some questions that we've received, if you and your partner are working remotely together, maybe there's a way of alternating childcare. Thankfully, my husband is with our 4.5-year-old right now, so I could be here with you. Another thing is maybe work for an hour and then have your plan be with your kids. Okay, then we're going to take a 15-minute break and play together. You might have a door sign so that your partner and kids don't accidentally come in when you're in a remote meeting, or situate your desk or the camera so that if they do come in, they're not automatically Zoom bombing your meeting just by entering the room. And give yourself some slack when it doesn't go as planned. Really, you have to manage expectations in the situation. It may be helpful to get real with your boss and coworkers, particularly those who don't have kids at home may not fully understand how challenging it can be. And as Chris said, with the working from home with kids, it's really challenging to get the work done. And I want to point out that this need to communicate with your coworkers and boss is especially true for working fathers, because gender bias can play into an incorrect assumption that that fathers have fewer family responsibilities. And I missed my. Okay, so that was manage expectations. And then finally, self-care is not selfish. So circling back around to Bryan's earlier point that Chris also echoed on how we can cope with anxiety, you can be a better caregiver when you take care of yourself. So whether, that's getting good sleep, getting exercise, connecting with friends, a walk outside, meditation and breathing, as Bryan outlined for us. And modeling these good self-care practices are really important for your children. So thank you. I'll put up some resources that we have here, and these will be available to you all as well.
Thanks, Rachel. And so now I think we have, maybe 20 minutes left, and we can transition into some of the great questions that were submitted in advance by people. In addition, if you have questions that have come up during the presentations or come up at any time, just drop them into the chat and I'll make sure to surface those for our speakers. So question about family here. My teenagers, and yes, my husband, keep interrupting me during work meeting calls, Zoom or otherwise. I've tried to convey to them not to interrupt me unless the house is burning down, yet they continue to poke their heads in my meetings and ask questions or ask where things are. Any strategies you have would be most appreciated. You touched on some of these issues in your prepared remarks, but yeah, what would you advise?
Yeah, I'll start, and maybe Chris will want to jump in as well. I think that my son has Zoom bombed practically every meeting that I've been in, and that's just the new normal. And so I think that it's really helpful to recognize that this is true for so many people, and normalizing it maybe can alleviate some of that stress. But I think also communicating what are those really important times, and communicating that with your family so that they know. And it may not be that that's the whole day, that you can work independently, but communicating like this is a really important one, and it would be really helpful if you didn't come in at this time. Anything to add, Chris?
I would just say that I agree with everything that Rachel said. I would add that a lot of us know that our animals also don't know the boundaries of doors. And so animals Zoom bomb, it appears just as often. And I think all of us in Zoom meetings learning flexibility, but also I literally have to give my family a schedule. And if you need to give your family a schedule when you really, when everything's on impossible, like do not interrupt me for anything at this time, if I write it down, they seem to do a lot better than if I tell them. Stick it on the door or whatever works. But that's the one thing I found stops my family at the door is when I've given them a schedule. I have BOD problem, interference problems. So I also have to keep my family off the internet and off of movies and certain things at certain times as well. So negotiating access is also a family issue.
Mm-hmm. And we also often will have do the grandparent chats when if there's no broadband issues during those times when you have to be on a meeting. And so that's something that grandparents can help out with from afar by knowing that they can be on FaceTime or whatever at those times as well.
Excellent. Yeah, Rachel, thank you for that answer. That question was surfaced by Moraine in the chat about what grandparents and others can do from afar. I know that's a question I get so frequently from my mother across the country. What can we do? What can we do? What can we do? And I'm like, yeah, you can't watch the kids for me. You can't do, yeah. So coming up with creative answers there, and it's a two-way street, it would seem. We got some questions about longer term effects. One in particular is, I'm worried about the long-term effects of this crisis on my children. My grandparents were, quote, children of the Great Depression and saved every bit of tinfoil and wire they ever owned. Any predictions from the panel on what our kids will carry forward throughout their lives?
I have some thoughts on this, but I'm not the child expert, so I would love to get Chris and Rachel to weigh in afterwards. I mean, I think that there are a lot of different possible positive outcomes that may come from this in terms of an awareness of the resources that people are using. Saving every piece of tinfoil is one extreme, but being aware of when we're throwing away food versus using food, I think is an important differentiation to make, and making sure that people have an appreciation of what it is that we do have during this time. Learning skills, I think it's one of the big internet trends now is everybody's baking bread, everybody's making these elaborate recipes. I do think people are getting a little more self-sufficient and understanding the importance of self-sufficiency in ways that maybe it hasn't been so salient before. I referenced gardening earlier. There's a huge resurgence in gardening now. You can't buy seeds at garden stores almost anywhere in the US because people really want to learn how to grow their own food and learn how to take care of themselves. So I definitely have some thoughts about long-term effects other than that, but I also think it's important to think about what are the ways that we can learn from this time in terms of being sure that we can become a little more self-sufficient and capable as people.
And I guess, Bryan, I would just add and take an angle on it that our parents, we weren't very psychologically minded at that time. As a matter of fact, psychology really emerged in the 60s and 50s and 60s in the US especially. We weren't very psychologically minded. I'm not sure we thought much about the long-term impacts of some of, say, our anxiety on our kids or our depression on our kids, or how I think a lot of parents are very conscious, and asking this question shows an awareness. So I think we have, like Bryan described, skills. The mental health professionals, if you get overwhelmed, can help with skills. There are developmental psychologists like Rachel, who also can talk about what's normal developmentally. I think there are some things that are going to be hard and difficult that are, just something we're not aware of, but I do feel that we know so much more that we can bring to the table and offer people in terms of how to manage the stress, distress, anxiety, or depression that comes from this.
Yeah, and maybe the only thing to add from my perspective is that the kids are incredibly resilient, and they will, they're going to be paying attention to how you as adults are in the situation. And so, not that I don't want to make that a pressure piece of like being perfect, but rather that if they know something's going on, and being able to be honest with them and talking with them, about what's happening. And I think being honest with your child, I think is, because they're absolutely aware, obviously, that something is really changed in all of our lives, and they will roll with it. So there might be, my grandmother does the 4-corner fold. She can't leave any, food, and into the purse. And so I get that. And there may be pieces of that, but maybe, as Bryan suggested, in ways that are actually, lovely.
Super. We are just getting a ton of awesome questions here. I wanted to interject one thing, Maureen's question about what can grandparents do. It's this thing we've been doing in our family, is we've been using social studies as an opportunity for our children to interview their grandparents about periods of time from their history. And so, yeah, it's been really useful, two-way street, and I think educational for everyone. A question here for Bryan. A few people have asked, can you develop a little bit more of your thinking of how what we learned from the HIV/AIDS epidemic might translate to things we can learn now or will eventually learn from the situation we're in?
Sure. I'd be happy to elaborate on that. I mean, I think that it needs to be, I want to give the caveat that these are very, very different pandemics, and, there are different types of infection, different consequences, and certainly different demographics in terms of who they affected initially and now. I do think that what we're learning in terms of being able to understand human behavior during a pandemic is pretty similar, which is during pandemics, often what happens is that people feel very afraid, and they're afraid of their own risk of contracting a disease, and they're afraid of perhaps maybe the harm that might happen to other people. So when people are afraid, oftentimes one of the negative consequences of that is that they may blame other people or stereotype or label people on the basis of their risk for a particular disease. So I think it's important to make sure that we don't do that in terms of not marginalizing the people who are already bearing the brunt of a particular disease. And I think that's an important lesson to learn there as well. One lesson that I've been thinking about as we've been following the news, of course, in terms of what COVID does and the potential connections to Kawasaki's disease and a number of other different manifestations, is that we really don't know a ton about viruses until we have a chance to really thoroughly study them. And the same was true for HIV as well. Initial HIV manifestations were cancers that people started to have, or, a number of different kind of immune-related conditions that were thought thought of as being very rare. And then it became clear over time that this is an autoimmune condition because HIV is attacking basically our T cells and preventing us from being able to fight off other infections. So similarly with COVID-19, I think we just really don't know a lot yet in terms of what this virus looks like. You know, we're tracking certain metrics in terms of infection rates and deaths, but it's worthwhile to be constantly kind of on the lookout for different things that might happen also. I don't want to take up the rest of the time. I could probably speak on that some more, but I'd be happy, of course, if people want to email me and want to chat some further to have that conversation as well.
Super. Well, I think we have time for one more question, and this is one that it would be great to hear from each of the panelists. As 3 prominent faculty members here at the University of Montana, please share with us your observations of how your students handled the stress and displacement of moving to exclusively online coursework and the shelter-in-place modality. And how did your faculty colleagues handle it? Chris, why don't you start with that one, because I know you have another Zoom to get to right at 5.
Yes. So I actually, the university did do a survey, and I did look at the results, but of course had my own experience, as did Bryan and Rachel, with managing it myself and experiencing students' management of it. I think in general, it was phenomenal to see what everybody, students and faculty, could pull off in 1 week's warning. We basically had spring break to shift in-person instruction to remote instruction. And that was challenging. I think many of us are not online faculty. Our courses weren't designed to be online per se. And so shifting our teaching styles, the material, et cetera, to that was a challenge. I think as students experienced it similarly challenging. A lot of students who take face-to-face classes take them because they prefer face-to-face, or they want what they're going to get out of a face-to-face. And this was present in the comments from students in the survey that, you know, I expected a face-to-face class, I did not get one. So we learned that remote learning, really, you're teaching different, maybe the material's different, you experience it different. And I think it's emotionally challenging and exhausting, especially if you're not used to it, both as a student, and I know Rachel and Bryan feel like I do, and as a faculty. It's pretty exhausting to Zoom an entire class and lecture. So I think it has those things. I'm going to let other people comment, but we did amazing things, and it did amazingly well, is what I would say.
I would say that it was, so I was this semester teaching both undergrad and graduate courses, and I handle them really differently because of the different constraints. And I think for my undergraduate students, I intentionally made things really flexible in terms of deadlines, because I knew that there was going to be a lot of other things that they needed to prioritize, whether it was moving back home or figuring out, you know, internet situations that would potentially be helpful for them to have some more flexibility. And in the end, a lot of students shared that was really helpful. And so I think that I provided reasons for why I did things in the way I did, and it seemed like that was helpful for them to understand that my choices were for particular reasons. I'm a developmental psychologist. You do that with kids as well. You don't do things arbitrarily. You explain why you're doing things. And it was challenging. I think it was challenging for every student. There were a range of issues that made it that way. And I think that it was also, despite all of that, as I think one student said, it wasn't as awful as I thought it was going to be. And now we've all come through our courses. Yeah.
I'll just add a tiny bit because I realize we're low on time. You know, I did collect data on this because I wanted to see what my students from my 2 undergraduate classes thought. And the short note is most of them said they thought they learned as much, but they didn't want to do it again. So they really wanted to have face-to-face instruction. You know, the other thing I think is worth thinking about, people often think about faculty as teaching, and that is a huge part of what we do, but everything that we do moved online. So not just teaching, but research, clinical service, administrative work, all of that has shifted online over the past couple of months. So it's been a big change for us in terms of teaching. And it's also worthwhile in terms of making that shift because we want to be there for our students and for the university.
Awesome. Well, huge thanks to our expert panel. I'm proud to call you colleagues, and I appreciate all of your advice and passion about these important issues. The group obviously appreciates it as well. We get a lot of encouraging comments. We get great retention of the audience throughout. So thank you to everybody for participating. Join us next Wednesday for another session called Uncertainty Surrounding COVID-19 and What the Future Holds. That will be a presentation by 3 of my faculty colleagues in biological sciences and the College of Forestry and Conservation. Thank you to everybody. Take care, be well, and go Grizz.